Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. I'm Olivia Lemon. Today's topic is replacing a joint replacement. How long does a joint replacement last?
Usually we'll say at least 15 years is the expected survivalship, but a lot of the implants we have today with the special plastic liners can be expected to last 20-25 years.
What are some reasons why a hip replacement would need replacing?
Because so many hip replacements are being implanted every year, needing to have them redone is something that happens, and it happens quite frequently. And it happens for different reasons, sometimes because the ball dislocates from the socket multiple times, in which case it has to be fixed with surgery. Sometimes it's because the plastic wears out, which is not as much of a problem as it was years ago with the newer plastics that we have. And sometimes it's for infection.
Are there any extra risks in having a joint replacement replaced?
Basically, all the risks are higher when it comes to revising a replacement or redoing a replacement. So the risks of infection are higher, the risks of dislocation are higher, and the risk of fracturing around the implant or continued pain after that are all higher. The surgeries typically take a little bit longer. There's often a little bit more blood loss. The recovery is longer too.
What makes the recovery longer?
Typically a bigger surgery. Sometimes patients will have a little more limited weight bearing and some more restrictions following that surgery to try to let the bone grow into the implants better. And sometimes the worn out replacement creates some damage to the surrounding bone that has to be fixed with surgery that can require a little bit more prolonged recovery.
Can a replacement be replaced just once?
With the technology we have now to reconstruct hip joints, the possibility to replace it as many times as it needs to be replaced is essentially there. At some point, the amount of bone that's remaining becomes compromised, but we have a lot of solutions for dealing with those problems now, which we're very fortunate for.
Can a knee replacement be replaced?
If you need to have a replacement replaced, the most common reason is that the plastic piece becomes worn. And so this replacement is made so that we can take out the plastic piece and leave the metal pieces attached to the bone and put in a new plastic piece. If you ignore the symptoms of the knee replacement wearing out, which are pain and swelling, you could damage the metal on the end of the bones, or you could have loosening of the metal from the bones. That's a much more difficult operation to recover from. It's a bigger operation, but it's something that we do routinely.